Welcome to yet another exciting live fireside chat on decoding employee wellness benefits, curated by Economic Times, HR World, and Policy Bazaar. My name is Soumya, and I'm going to be your host for today's session. Today, we have come together with a powerful panel to sketch and discuss a well executed proposition that will boost the overall healthcare matrix of an organization and higher levels of employee retention. The ramifications of the pandemic have led the organizations to make amendments in the way they function. At this time of continued uncertainty, it becomes critical to lay out the roadmap for the future and put strategies into place. An effective employee wellness benefit strategy will elevate the employee experience and CX exponentially and augment people and work productivity overall. Today, we're going to find answers to many more such questions, and I am super elated to welcome the dynamic panel of speakers for this intriguing and an invigorating and yes, a super promising session. Joining me first is Amit Sharma. Amit, in a career, comes with the spanning of more than 2 decades. He's worked across various HR roles with top of the line organizations in a diverse set of industries such as Indian Oil, Johnson and Johnson, Philips, and TE Connectivity. He is a proponent of bringing technology to HR processes while retaining the human connections in the organization. As an HR leader, Amit has been instrumental in building a sustainable, high performance people culture in the organizations he's worked for. Joining us next is Raghuveer Malik. Raghuveer is the business head for corporate insurance at Policy Bazaar. With over 12 plus years of experience in insurtech and fintech, he's built and scaled businesses from scratch. He comes with a deep understanding of the Indian startup space with expertise in end-to-end digital and retail distribution. And yes, joining us third is Sudeep Prahlad. In his current role as the lead for the people function for Walmart Global Tech India, Sudeep is responsible for driving sustainable growth and embedding a culture of inclusion and innovation for a workforce spread across Bangalore, Gurgaon, and Chennai. Sudeep is passionate about diversity and leadership and likes to work with leaders who are value driven and forward thinking. I know this panel looks really intuitive, so let's get started with it. Please park your questions for the end of the session. We have budgeted time for it and we'll surely try and find answers for all of them. So before that, a big welcome to Raghuveer, Amit, and Sudeep.
Thank you. Glad to be here.
Great. Thank you so much. And yes, everyone, I just want to open up this discussion for an audience with an overview on what you're going to go about it. So my first question is that could you, and please feel free to answer because this question is for the panel. Could you share an overview of how has the wellness strategy changed in your respective organizations in a post-pandemic world of work? And we can probably highlight one main change that we witnessed.
Sure. So do you want somebody to go first?
Raghuveer, you can take it over.
Awesome. So I'll try and give a broader level client overview, right? That the fundamental shift that we have seen in the concept of an organization planning its wellness strategy has been in the concept of health and wellness itself. So if you think about it at a personal level, we all started to question our state of wellness more than ever before, right? You had more time, your chai breaks weren't with colleagues anymore, travel time was saved, and your social life was limited to whatever you could do within your house, right? That, along with the fear of death and disease around you, led to a realization of finiteness and a focus on better physical and mental wellness, right? So at an employee level, what we have noticed over the last, let's say, 6 to 9 months, when organizations come up for fresh health insurance policies or wellness plans, basic health insurance product, with access to medicines and lab tests is coming across as very reactive. What we have seen is that people have started requiring or seeking preventive wellness options, ranging from mental health and mindfulness, better fitness, better nutrition, and better appearances, right? So this is one of the biggest shifts that we have seen, is that more and more companies are seeking more expansive and holistic wellness and benefit plans.
Thank you for that, Raghuveer. Amit, I'll come to you.
Sure. I'll just pick up the thread from where Raghuveer has, left. So it's really been a fundamental shift when it comes to wellness. Two things which have happened, in my view. One is that wellness is right in the center of the discussions. Something which was, either not there in the discussions, or it was some last slide in some strategy discussion or some plan discussion. Okay, we also need to do something about that, and which was primarily looked at from a point of view of, as Raghuveer said, uh, social security, medical supports, and all of that, or insurances, or safety from a point of view of factory. In the manufacturing, we used to talk of safety, but again, that was more of physical safety. How do we ensure that there is no injuries on the workplace? So the discussion around health and wellness was only around these two factors. What's the insurance support we are giving? And how do we ensure a physical safety for the people who are coming to our office? Now, what has fundamentally changed is that number one, the larger wellness concept has come to the center stage, both for HR as well as for the business in totality. And we are talking about all aspects of wellness in a comprehensive manner, whether it's mental, emotional, social, economic, physical, fitness. All of that is coming together. I was really surprised when we were having that brainstorming discussion and economic wellness came in. I said, from where, how are we thinking about economic wellness? But then we felt that, we are finding situations where families are in a situation where one of the spouse has lost the job, or we have seen that the spouse, or there's a reduced income for the spouse, that the spouse was in a business, and the business is not doing very well. So which fundamentally disturbs the overall, financial health of the person, and that itself starts creating more health issues, more stress issues, because how do you really maintain your lifestyle? So even that aspect is very much on the table, apart from the normal physical, emotional health which we are generally talking about. And the last piece is the fitness. Because of the more sedentary lifestyle which has happened during the lockdown stages, where people were literally not going out, that has become another important aspect. That how do you really ensure the larger fitness, both from a body and mind, around this? So that's a shift which I see.
Thank you for that, Amit. And I think that's very, very relevant. And I'm going to come back to you and dig a little deeper on that. But right now, moving to Sudeep. Sudeep, what is your take on this?
Yeah, I think Raghuveer and Amit have covered both the aspects about how the dynamic changed, for people at large, and people have used this time to reframe their lives in many ways, and how wellness and well-being, and which are actually slightly different words, and we'll come to that later, have moved from the periphery to the center of the agenda. I feel the COVID wave too, while it was tragic and everything that went with it, also changed some very fundamental dynamics in a corporate structure. So the expectations that the workforce has of the organization changed very fundamentally during this period, right? 2-3 years ago, you would not expect, you expect the organizations to provide insurance, for example, and basic benefits like that. But suddenly the expectations changed and organizations stepped up to that, right? People's expectations changed of each other. It was fantastic to see how people stepped up and supported each other during this period. So many interesting working groups came together, support helplines came together. So I think that is a very fundamental shift that took place in our corporate landscape, which will have a very far-reaching impact, right? Which kind of has led to what Amit was talking about, bringing well-being in the center. But not just that, it's changed the workforce expectations itself. And, the way I would even liken it to, say, 20 years ago, when diversity and inclusion came from, I think, the periphery to the center of the conversation. I think we see a fundamental shift happening this time.
If I could add one small
Yes,
point,
please,
right? Like, so I think one of the other trends which are worth taking note of is that we see a lot of smaller companies, right? A lot of startups, a lot of gig economy companies with gig economy workers, also demanding what earlier we only saw very, very large companies with large, HR teams or large budgets providing their employees. Because the fundamental requirement is not coming from Raghuveer or Sudeep or Amit as HR or corporate insurance people, right? The fundamental requirement is coming from Amit, Sudeep, Raghuveer, and all the other employees as consumers. And hence it comes across size, it comes across type, it comes across, profile of work. And that is something to take note of, that smaller organizations, 7-member, 12-member, 15-member companies are also today, asking for and wanting to implement very comprehensive wellness benefit programs for their employees.
Thank you. Thank you for that, Sudeep and Raghuveer. I think this really adds a very clear overview of how things have changed. I will now get into a little action mode from here. And like I said, it's a privilege to have three of you together. So my second question is, and again, I would want to kind of cover it with each one of you and take, make the most of your experience. What are the key elements of curating a comprehensive employee wellness benefit strategy? And while I ask you this question, it would be great if you can highlight two each. And I can actually now I'll go with one after the other. So I'll start with Amit first.
Okay. So if I were to limit myself to two, though I can really talk of multiple things. The first and foremost piece is that we really, when we are creating our employee wellness strategy at an overall level, we really need to look at employees as different subsets and not as one comprehensive group. I think because there are different generations have different needs. Your basis, your life stage of you have different needs. If you are single, married, you have different needs. If you have kids, you have different needs. Parents are staying with you, it's a different need. So there are multiple, requirements of an employee. Generally, we tend to do, and whenever we are creating a policy framework, generally we create one policy structure for everybody in the organization, right from the CEO to the junior most level. You follow the same policy. That's typically what happens. But when it comes to wellness, it's very, very critical that we are creating that strategy while stratifying our employees into various subparts and then curating a benefit plan or a strategy which is appealing to different people through various means, whether it's through flexibility means or any other means. But that's one piece which is very, very critical. Second important piece is about, though, as much as a strategy is important to be put in place, how much of that the larger ecosystem is supportive of that. So it's important to put together something, in terms of what we want to do. But are we creating the right, organizational processes which are supporting that wellness goal of the organization? Or are we simply saying that, we're talking about it when it comes to actioning on the ground? People are still, working, let's say 12 hours, 13 hours. There are still high demand. There is still stress on the table. There are still expectations, to work over the weekend. Multiple things, or managers calling people in the late evenings or early mornings, or various things. What kind of processes we are building apart from the strategy to make it really effective? That's the key. So if I have to limit to two, I'll limit to these two on that subject.
Great. Thank you so much for that, Amit. And I totally agree that, a one-size-fit approach will not work now. And we are aware of that. So thank you for pointing that. Sudeep, I'm coming to you. What are your two, takeaways or probably like the nuggets for our audience?
I love how you've given us this task of having two each. That really means that by the end of this, 5-minute conversation, you would have actually a holistic framework ready for a strategy. I think Amit made some very valid points on the one size doesn't fit all and the leadership part. The couple of pieces I'll add to it is, like any good strategy, I think employee benefits as well, when you think about it, has to be designed in conjunction with people. So I think having a constant dialogue is super important. Whatever you use, you could use surveys, you could do ask me anything, conversations and sessions, you could use focus groups. But remember that you have to approach this, and this has become like my favorite quote of late, that you have to approach it like a marketing function. Because, like Raghuveer said, employees are your consumers and you are the product. So how are you going to, cut through the clutter and go to the heart of what your consumers really want and ensure that you design an experience that matters to them, is relevant for them? So I think that's one element I would talk about. The second piece is the point I alluded to earlier as well, that well-being is now much broader than just wellness, right? Wellness is part of it, but people want to feel, and we've been seeing it constantly. We've seen so much research recently, especially on the talent churn that's happening in the market, right? That people are seeking experiences and fulfillment. So when organizations think about well-being, they should be thinking going broader than wellness. They should be thinking infrastructure. They should be thinking policies. They should be thinking elements like recognition, right? All these other elements which contribute to a sense of well-being for the employee and for the associate, right? And of course, wellness by itself, there's plenty of stuff to be done. Again, going back to the same point about thinking like a marketing function, like we were seeing webinar fatigue, right? So we decided to do something different. For the mental health, we did an improv theater workshop, and we got people together, and it was such a great experience of hundreds of our associates interacting with the actors and engaging in a conversation on mental health. So I think you really got to be sort of up the game a little bit on this one, because traditional routes are no longer enough.
That is a great sum up, I must say, Sudeep. Thank you so much. Raghuveer, I'm coming to you. And while you answer this, I just see there's an audience question that has come in, and maybe it is very, very relevant if I take it with you, that are organizations and insurance providers open to develop an account-based employee personal health records, which will help in having a comprehensive health data of the employee for efficient risk coverage? I think that's a very, very, suited question in this discussion. So happy if you could take this up for us.
Sure. So I'll come to that, but I wanted to first, just add on to what Amit and Sudeep have said, right? I think Amit is absolutely right. It must be personalized. What a 20 to 30-year-old requires, maybe a gym membership, digital fitness studio, mental wellness, engagement inbuilt, gamification to increase employee engagement, is very different from what a 30 to 45-year-old may require, which is more, tailored towards primary care, an OPD policy, diagnostics with a cashless network stitched up. So totally agree with Amit that personalization, not just at an organization level, that every organization is different, but also at an individual level, right? That or there are cohorts within your organization which require different wellness and benefit schemes run out there, is very important. I'd like to add just one point to this. I'm sorry, I don't have 2 points. Is that as the mandate becomes larger, as the definition of wellness schemes becomes more expansive, as we try to personalize more and more, you also need to deal with the complexity that comes with it, right? So, if you have one policy which is for everybody, fairly simple to build processes, policies, implementation, and rollouts for it. But if you have different cohorts with different kind of tailor-made options for them, which are based on their wellness requirements, it is slightly harder to roll it out and to maintain it across the year. So just note, and I think all HR and founders should note this, right? That as individuals, we use Amazon, we use Swiggy, we use Yatra, we use Ola, we use Big Basket and many other brands, right? For our everyday needs. And why do we use them? We use them because they have extensive networks, they're exhaustive. There's a simple app-based or web-based interface which gets the job done. And service excellence is not really a luxury on these platforms. It's a part and parcel of the product. So with complexity and personalization increasing, please, we should not expect our employees to appreciate efforts. However, brilliant the strategy would be, as Sudeep mentioned, if the UI UX or the service delivery is broken, right? Just one very, very small point that I wanted to make in relation to the question that has come up. Are organizations and insurance providers open to develop an account-based employee personal health records? I would not be completely aware of the regulation around this. I do know that there is there's a Swasth Ayog, which is working across insurance providers, healthcare providers, to develop an ID-based system which is linked to your Aadhaar, which creates a health record, not just for demand, which is you and me, as consumers of hospitalization, but also for supply in terms of which doctor is available where, how experienced are they, which hospitals they worked in, to be able to, in the future, if a pandemic arises, to be able to ensure that you have enough resources available at the right place at the right time for the right number of people. So I really don't know if an insurance provider or policy bazaar regulatorily, I don't know the answer. Maybe we can engage in this, but I do know that there is a government-backed consortium which is working on this as we speak.
Absolutely. Great. Thank you for that, Raghuveer. And I hope, Danny, you found your answer. I'm going to take this discussion to a little newer trend that's coming in. And I know all of you know are aware of it. This talks about the Great Resignation and the problems that comes with it. And probably, I would say the symptoms that comes along, if I can use the right term here. So that really brings me to one of the aspects that I really want to kind of uncover in this conversation is wellness programs can actually help improve your employee recruitment as well as retention. I would want to understand from you all that have you seen any significant shift after customizing the wellness programs for your workforce? I hope it's a positive, or even if there have been some alarming metrics, we would love to hear from you guys. So just if you could share one trend each, and like Sudeep, always mentions that I just tie you up with one, but would be really great to understand. So I think I can start with Raghuveer, you.
So I can talk from the perspective of an insurance broker and what we've seen in the market, right? What we've seen is that it's not just about salary anymore, right? And I can say this as a person who's trying to recruit his team at the moment as well. It's not just about salary at all. And especially if you're in the gig economy, you're in a startup, you're in smaller companies. When people were impacted by the pandemic while serving their companies, they spent a large fortune, sometimes more than their annual pay on healthcare for either themselves or for their families. So the existential question was asked, what does my organization do for me? I would say that there are very few companies I've come across who are not asking us now for home care treatment covers, parental covers, pre-existing disease cover, room rent in the ICU treatment, being higher. And one more thought over here, right, or trend over here is that very often I've seen over the last, let's say 6 to 9 months when the renewals have come, that people come up and say, we want to renew basis our expiry policy. And within, I think, 2 or 3 weeks, when they start discussing it internally with their employees, with their management, they come back saying, no, expiring policy is fine. I would like to add 1, 2, 3, 4. Please come back with a quote for that, right? So we are noticing that a lot of employees, and I have noticed this, I had somebody who did not join us because last year in our policy, we did not have a parental policy, which was as great as his policy in another organization, right? So we got it included in our policy this year. He said, look, I have a 10 lakh rupee cover for my parents. If they fall sick, I don't have 10 lakhs to pay for it, but my company pays for it. So even though I like the job here better, unless you're willing to cover my parents and all their pre-existing diseases, I'm not going to join. I can't join. So, like things like this are propping up, and I'm sure Amit and Sudeep would have a way more, I think, pointed answer.
Absolutely. No, thank you. Thank you so much for that, Raghuveer. And Amit, I'm coming to you now.
So two aspects to this. One is the hiring piece which Raghuveer just talked about, because employees are asking for it. See, and this is an interesting trend which has changed. Earlier, if I were to go back about 3 years, people who talk about what cash you're giving me, that what matters, whatever was the peripheral benefits, it doesn't matter. And all these brick and mortar companies, at least I have worked with, all of them had really good, nice benefits package, and we used to struggle selling that to the employees. Hey, don't look at cash, look at, so the bouquet of benefits you're getting, the medical cover, the social security cover, the other related peripherals which you're getting here. Look at the total value proposition, but employees were like, you tell me what is the cash in hand I'm getting, that's what matters to me. I'll take care of my own insurance, don't worry about it. I'll take care of my own social security, don't worry about it. It's my job to handle it, you give me the cash. Now, the conversations are changing. And as Raghuveer said, the converse people are asking, okay, cash is one. What is the benefits basket, especially around medical, more than anything else, especially around social security, more than anything else. So that's coming back. And I think organizations will now have to relook at their overall rewards proposition than what they used to look at it earlier. And the rewards strategy or the proposition has to be once again much more holistic as it used to be earlier. as people are now appreciating that aspect much more, having gone through these two waves of COVID, seen people, are losing their friends, their relatives, their near and dear ones, especially the second wave. I didn't see that much happening between the first wave and second wave, by the way. But second wave, I would say, is the watershed wave, where the conversation around this has fundamentally changed. So that's one part of it. Second piece is internally about what's happening to the employees, because employees are also asking for the similar piece. What is the kind of flexibility you are giving to us in your basket, and what are the other facilities which are coming up? And this is where what we have seen as we introduce a lot of as customized benefits for the employees in the last 1 year, and introduce something we called as the flex benefit basket, where we said, okay, this is the whole basket. You choose what benefits you want to have, and predominantly, there were various wellness. I would call it was a buffet of various wellness benefits, and we allowed people to choose what they wanted to choose basis their lifestyle and their needs. We actually saw the engagements going up. We recently done an employee engagement survey where all our scores have been moving up, especially around care, especially around work-life balance, especially around health and safety, because people felt that an organization is caring for them and is thinking about them. So I think it has the merit is on both sides, both in terms of engagement of existing employees as well as hiring of fresh talent. But I'll put one caveat there. Just because you have this bouquet of benefits in the organization, it will not mean higher retention, because this will become norm. This will become a hygiene factor which everybody will have to provide. And then things will be on top of it. So today it may seem like a novelty here and there, but very soon it will be a hygiene which you will have to do it. Without that, people will not even consider you for joining. So that's something is also happening.
Thank you, Amit. I just love the candidness. And this is so true. I think I could relate. I was nodding my head all along that yes, 2 years ago, I was not really thinking about it. It was all about my take home. But today, the conversation and the focus has really shifted. So thank you for highlighting that. Sudeep, I'm coming to you now.
I don't think I have anything, significant to add beyond what Raghuveer and Amit, I think, covered very comprehensively. My indicator, one of the indicators that I use is campus placement conversations. Over the years, and not to belie my age, but I've been doing campus presentations for 20 years now, and I've seen over this period, right, starting with just a focus on brand and how big the brand is, to then talking about compensation, to then talking about benefits, to then answering questions about diversity and inclusion, to sustainability, and now well-being. You can sense the way the sentiment is changing over a period of time based upon the questions you get from campus folks when you're in these presentations. And that clearly tells us exactly what Amit said, right? That the expectation has changed, and two, it's a norm. So it's no longer, it's become a hygiene factor. So the presence of comprehensive well-being may not necessarily help you attract or retain talent, but the absence of it definitely will impact your ability to do so. And we're clearly seeing that. I mean, a lot of times, our next year's thinking around well-being is clearly being shaped by feedback coming in to us from candidates, from our associates, who are telling us what's working and what's not working. It's also interesting to see sometimes they're telling us this is great, but actually it doesn't work for us. So no need to do this anymore. So it's a question about, also shuffling resources.
Thank you, Sudeep. I think just double on that your employees are very honest. They tell you what is working, what is not working. And I think that another is a shift that we've seen in the last 2 years, because earlier it was not like that.
Absolutely.
People were not so vocal about what they wanted. But now I hear from all of you that yes.
You'd only get to know after they exited. But I think now people are also a lot more, you're right, vocal, especially in organizations which have built a more trusting relationship. And I think that's happening across the board, from small to large organizations.
Absolutely. I think that's a beautiful trend. And that does bring me to my next question in line. And, how are leaders actually prioritizing wellness alongside the health and safety that we discussed, and the importance of keeping employees connected and engaged? during these times? Because I'm sure that is one of the challenges that you all must have faced. So would be lovely to hear. And I'm going to start with Sudeep, you?
Cool. It's been a very tough set of prioritization, honestly, Samir, and that's exactly the right word. I mean, look at it from an employee, from an associate perspective, right? People want to feel safe. People want to do that. People also want flexibility. So there are people who moved to their hometowns and so on, and they want to maintain that flexibility. But people also want to connect. People also want to build relationships. They want to learn from each other. They want to get mentored. They want to mentor others. And the same thing from an organization's point of view. For us, it's top of the mind right now. 50% of our 9,000 odd workforce were all hired virtually in the last 1.5 years, right? So how do we build that deeper sense of belonging, the fulfillment in such a scenario is incredibly difficult. I think there are 2 or 3 things that organizations are doing, and I think Amit and Raghuveer have also referred to those. One is obviously a focus on leaders and managers itself. Poor souls, I feel very badly for them. They are really the ones who are carrying this entire mantle. But really rethinking about their roles and how they can be a lot more deeply connected to their teams and enable that, I think that's important. Second, as an organization, it's all about communication all the time, right? So whatever forums you use, our Ask Me Anything sessions have been super successful, or town halls or other events using that. But I honestly feel that going forward, we will all be learning as we go along. There is absolutely no right answer. With such a fundamental shift that has happened in the entire landscape, there is no way we're going to be able to find the right model and the right answer within a few weeks or a few months. Organizations, just the working from home policy and the work remote policy itself, right? From organizations that are doing fully remote to people that are bringing everyone back into office to ones like ours that are doing hybrid models, we'll all be learning along the way, not just within ourselves, but with each other. And I think we'll find the right answer, maybe a year or 2 down the line. Till then, honestly, it's not going to be about trial and error, doing things with the right intent, and then just being open and honest about it to say, we are literally learning as we go along.
I think I couldn't agree more on that, Sudeep. Thank you so much. Very rightly pointed. There's no playbook that we can refer to. Everything that we had learned has actually been washed off in the last 2 years. And now it's just the intention that matters, and we'll learn as we go along. So thank you. And now just taking a cue from that, we learn as we go along. I'm coming to you, Raghuveer, for the question.
Sure. See, I agree with everything Sudeep has said, right? Like that you need to keep iterating. Nobody has the perfect plan built out. You don't know what your tech team needs versus what your operations team needs versus what your delivery riders require, right? All the requirements are very, very different. But I think the key element that enables this to happen, right, is measurement, right? Now, I'll just throw some numbers out at you. For a majority of our clients where we have a comprehensive health and wellness program, which is not just a flexible benefit health insurance policy, but also added on, mental, financial, and physical health options. We see that as long as you back it up with a strong CRM, engaging content, and certain schemes to kind of increase the responsiveness to the program, we've seen 60% enrollment into our programs in the first 60 days, right? Around 40% of them engage with us on a monthly basis on our app, 15% on a weekly basis. Now, how do I know these numbers? I know these numbers because the delivery, or at least a part of the delivery, is done digitally. There is GA tracking. There is all kinds of MISs that are built out around various parts of the wellness program. If one thing is working, we can increase budgets towards that, or advise the corporate to increase budgets towards that. If something is not working or not being utilized, we can first try to increase communication around it, talk to the employees. If they don't require it, remove funds from there and put it somewhere else. So, this engagement with employees, tracking their steps, collecting, rewards, logging their meals, speaking to dietitians, using the telehealth services, all of this, points to just one thing, that employees are keen, right? So to your question that what should leaders do? I mean, leaders, it's very simple. Just take note of this. Employees are keen. There's zero doubt about that, right? Now, one small point that I want to add on to this is that with large companies with budgets and teams to execute to their desires, it is a matter of finding the right fit for their corporate, right? For smaller companies, they don't have, a senior HR manager. It may just be a founder with 12 employees in his or her company. So we work with 5,000 such companies, right, with much tighter budgets on digital delivery of telehealth, medicine, mental fitness, physical fitness at prices that are, I mean, let's not get into the prices. The prices are very low, but the delivery is done digitally. So that means that the company does not need to get involved in telling their employees, in reminding their employees, in enrolling their employees. The claim or the utilization can happen digitally. If you have new employees joining, or old employees leaving your organization, that can kind of be tracked digitally, and new communications can be sent out to them. So to a large extent, I feel that the only way forward is to measure consistently and keep making iterations on a weekly basis.
Thank you for that, Raghuveer. Thank you so much. And I'm going to come back to Amit. And Amit, rightly, when he began discussing it, he said that the people are at the core of everything that we do. So, Amit, I think it's your time now to take over and share some insights with us.
Sure. Now, apart from what Sudeep and Raghuveer really covered quite comprehensively, that there is no silver bullet around it. We need to iterate. We need to continuously listen to our employees to see what works best for them. At the same time, certain things, in my view, leaders can do and should do in terms of keeping that connect with the employees, and making them reassured of the fact that as an organization we prioritize the health and wellness, or the larger well-being rather, of the employees. And there, the larger communication what the leaders make periodically, whether in the town halls or it is through focused podcasts around this particular topic, that makes a lot of difference. Because ultimately, how will an employee know what's an organizational priority? There are only two ways. One is when what their manager tells them to do, and number two, what they listen it from the leadership. So that has to happen consistently. If this is a priority, if well-being is a priority, then leaders need to talk about it. If the leaders are only talking about customers and the numbers and the financial statements in the town halls and not talking about this aspect, then it's very clearly, certainly it gives a message without even saying anything. The message gets driven down below that this is the priority. Because when the CEO is speaking about something, he or she will only speak what's important for the organization and what he or she thinks it's important for employees to know. So if the focus is only on what we are doing for the customers, what we are doing for our financial health, how the balance sheet looks like, then it will not give the right answer. So the first and foremost thing, in my view, is very, very critical. A larger communication, consistent communication across all levels about this particular topic. That company means business as far as health and well-being is concerned, is serious about it, and then backing it up with policies, processes which are supporting that. That's number one. Number two, and which will be very, very critical, is something. How do you really redefine your workplace principles now with this entire concept of hybrid workplace, which organizations are not talking about, which will be flexible. Some people may be in office, some people may not be in office. For some roles, people may be required to be in office full time. For example, for us, I can't have a hybrid workforce in my manufacturing setup. Whatever we do, people need to come to the factory to build a truck. I can't build a truck sitting at home. We have not reached that advanced technology. Somebody will press a computer button and the robot will come and fix the nut and the bolt if the tire gets fixed. That doesn't really happen. So for certain section of employees, people do need to come to office. Certain section of employees, their work is like that. Probably they can work remotely. So what are the larger workplace principles we are setting up and communicating it clearly to the employees that this is what organization stands for? Keeping in mind, number one, the health and safety. That always remains paramount, whether it's working from office or working from home or hybrid. all three situations should have a health and safety and well-being at the number one place going forward. That's critical. Number two, in terms of how do we really spark collaboration across employees in either of these three setups, office, home, or hybrid? How do you ensure that you are meeting the business requirements, in these three setups? So those are the three broad elements on which I would say the future workplace principles have to be defined and communicated to employees, and that candid conversation needs to happen from the leadership side.
Yeah, that's really amazing, Amit. Thank you so much for sharing that. And I think our audience is going to learn from it that if that's your focus, you need to talk about it. It cannot be your focus and your company and your workforce doesn't know. So that doesn't really go around. We did discuss the second wave and the repercussions, and I think we all have faced it in some or the other way, at least in India. So that brings me to a question that might not sound very positive. I would want to just ward off my audience, but I think that's very important to know. That what are the preparations from the larger aspects of well-being that leaders are prioritizing to face the anticipated third wave? So it might not, but we would love to know the efforts that are going around it. So I would like to start with Sudeep, you.
Sure. And I don't think it's a negative question at all. I think the COVID wave 2 was tragic, but like every tragedy, it brings with it a lot of learning and change. And there were some very positive learnings about it as well, about how people can come together, how organizations can come together. And I would just say that, we're trying to maintain that within the organization. We had, COVID support groups on workplace. We had helplines in place. We had, we rethought our entire medical assist sort of systems around it. So we're preserving all of it. But I feel that a bigger learning, which we should all take away from that period, is the agility part of it. All of us, hand to heart, when we look back at that time, I'm sure there are things that we did extremely well, and there are things that we could have done differently or better. So I think keeping those learnings in mind, and I think the biggest learning was probably agility. How to respond fast, how to make sure that you're not in search of perfection. How do you make sure that you are absolutely employee-centric in your processes? Those are things that I feel will serve us well, God forbid, if wave 3 were to strike us, or similar tragedies. I mean, not just wave 3, but any tragedy were to strike us in the future. I would say, it was all organizations for decades have had a BCP process in place. That really got tested in this scenario. And we have revisited our entire BCP processes, keeping in mind the need to be much, much more agile in the future. So that really is how we are thinking about it. And I feel that most companies would be too.
Yes, I think that's very true. So agility is one, and preserving your good practices is two. Amit, I'm coming to you for this.
So apart from what Sudeep mentioned, the second important piece would be, to me, the larger infrastructural preparedness in the organizations now to deal with that. Because I don't think, number one, in the first wave, we were anyways not prepared. And second wave, I think we just celebrated too early. Things have gone. Nothing will happen. So again, both waves, people were caught a bit unaware, I would call it. So I think now the larger infrastructural preparedness to ensure that if something like this happens, how are we going to deal with it? I think that's much better. And second important piece is also, and I'm sure all good organizations are doing it, is the employee vaccination programs, extending it to their families in many organizations. But I think the other important piece also we should continue to do is also be part of a larger, I would call it, I won't call it CSR, but that's something you can club under that. How do we do a community outreach, especially for a manufacturing organization like ours, where we have people living in, small towns, because our factory is about 40 kilometers out of the city. People live in the villages around it. And that's where we need to ensure that the community there is equally safe, because that's where they are interacting on a daily basis once they go back. So how can we ensure that even in those places which are a bit remote, not in the middle of the city, We provide that kind of a support so that we continue to ensure safety of our employees even when they go back and when they are interacting in the community around. So I think that's an important piece apart from what just Sudeep mentioned.
Thank you so much for that, Amit. Raghuveer, I'm coming to you.
Thanks. See, first, I'd like to acknowledge that across most of the organizations that I've gone and visited over the last 6 to 7 months, I think HR teams have been true heroes in 2020 and 2021, right? I've been in the hospital for 8 days. I don't have the cash. Can you help me out? I need to pay my bill. It's a reimbursement. I didn't know it's not a cashless hospital. I didn't get another bed. Or I need to get a vaccination done. Or I need to get a COVID, test done. I need to visit a GP. I am 23-year-old employee of XYZ company from Muzaffarpur, living in Bangalore, don't know a doctor, don't know anyone over there. And regardless of the time of the day, night, I've seen companies where, HR teams have just been on the ball 24/7, right? But I think the coming to the future perspective, what are we going to change going forward, right? Is that we must realize that when things fall down, they all fall down, right? So if I create a process where there is a call center and my people can't come to office, and if demand goes up, then my process fails, right? But today you can file claims digitally. You can intimate a hospital before going there. You can do a cashless claim using your app, right? You can upload your documents and get your money back in your account in 4 days. It doesn't have to be paper-led. Most of the insurance companies allow that. If you need to meet a doctor, you can also do it digitally, right? So you can say, okay, I want to meet a cardiologist because I'm feeling a bit uneasy. I can upload my previous prescriptions. I can request a call back on video or call. I will get a summary of our conversation in a medical management tool. And that links up to, let's say, a medicine delivery platform that can also deliver the medicines to me. So we have all of this. Any good digital broker today has all of this, right? Vaccinations, that's another thing we spoke about. We've now tied up with Apollo, Fortis, and a couple of other players, where across 90 to 120 cities, like I think 120 is what we say, 90 is what we can actually cater to. We can organize vaccinations on-site, off-site, paid for by the employee, paid for by the corporate. You can go to your HR portal and decide as a corporate whether you want the employee to pay for it or you to pay for it. You can set up camps around it. So somewhere I feel like along with all the things that Amit and Sudeep mentioned about, organizations becoming a little more resilient and prepared, the insurance industry, the broking industry, the wellness industry has also become, I think, a lot more aware of what went wrong the last time and has prepared solutions which are effective and available to this segment of requirements as well.
Yeah, but that's a good point, and maybe we can use this time to even respond to a couple of questions, Raghuveer. And in fact, there's one which directly, the first one, if you look at it, is very linked to what you said and your background. So I don't know if you want to take that, which is about how can a startup offer personalized wellness care to employees?
Perfect. So today you have about 4 or 5 portals where you can go and search policy, add various parameters to it, see the cost, request a callback from an advisor, and truly decide what makes sense for your organization and what doesn't, right? And there is technology that guides you through the enrollment, through the endorsement processes, and through the claims processes. You can plug and play various options from dental care, vision care, right? Pre-existing diseases coverage, maternity coverage, and even the limits that you want to set for various grades in your organization. So I don't think it's that hard for a startup to at least find out what kind of a policy to purchase anymore. In Policy Bazaar is one of them. There are other platforms available online. Just go on Google and search for employee health insurance. You will find enough people catering to this requirement who are genuinely all trying to make an impact.
Thank you so much for taking that question. And also, I am just seeing that I still have some time with you. So just wanted to go back on our discussion and take one more question with the panel. We did talk about that, how important it is to communicate your change, what you're talking about, and everything. So I'm just going to, put this question for the panel now that agreed on the fact that effective and consistent communication strategies are the way to address the change and create like a foolproof roadmap to implement the strategies now. Can we have one practice each, or maybe two, just in time of the time that I have with you guys? Can we have one or two practices or strategies that have worked for you? The way you've communicated this with the workforce, I think that is something which is like a very solid takeaway for our audience today. And we can start with Amit, you.
Okay, so two things which we did. One was, we during that time we actually launched a real time. It was like an employee chatbot, which was talking to employees, asking them about what it is, what are they feeling, what are they going through, and sharing that sentiment analysis with us. So we were really getting a real time feedback around what is going through an employee's mind, and then accordingly deciding how do we really work around it and how do we really manage that situation for the employees. So that was one. And second piece, which I mentioned earlier, is continuous leader conversations, including in every meeting used to start with talking about how are you feeling, is there anything bothering you, is there anything you want to talk about it first before we get into the agenda. And we have seen sometimes in a 1 hour meeting, 40 minutes for just went into these two questions only, that how are you feeling and is there anything which is bothering you and want to talk about it. And we said it's absolutely fine, because it's important for people to communicate, to share what they're saying and not really bottling it down. We can have one more meeting after this to talk about the agenda which was there. But I think having that flexibility, continuing to listen to the employees, whether it's through e-medium or through the connect sessions, that really helps. And then, leaders emphasizing it in their town halls everywhere. These three things are the ones, in my view, which worked good for us, and it should work.
Thank you, Amit. And I would just want to let our audience know that why this question is so important, because this just doesn't talk about what happened in the last 2 years. I think these are one of those good practices, like Sudeep mentioned, that we should preserve. So that's why this strategies would be really important. Raghuveer, I'm coming to you. What would be your top takeaway on this one?
On the implementation of whatever strategies we come across.
Yes, how those communications were made, and probably, and that can be taken ahead from here as well.
Sure. See, I think everything has its right time, right? And it's about shining a torch on a particular problem. As Sudeep and Amit have pointed out across this conversation, from the first question to this question, is that wellness, health, and safety is now up front and center, right? It's not a peripheral activity anymore. There are numerous ways in which you can simplify the operationally heavy, Excel heavy activities that take place between an employer, a broker, a wellness partner, an insurance company. Everything is moving fairly manually today, right? I'll give you one small example, right? We work with a lot of consumer internet clients. Typically high attrition, high hiring, right? Like, we have a company that went from like 15,000 employees to 32,000 employees in the last 6 months. So enormous levels of growth. Now, people leave, people join, people get married, people have kids, people get divorced. It's not about one-time communication. It's about repeat communication, right? It's about there being a digital framework in which information can be taken from the employer and then sent to the right stakeholder, be it the insurance company, the TPA, or the wellness partner, right? We today have integrated now with 2 HRMS companies, and we plan to integrate with the top 10 by, let's say, March of next year, and are trying out our digital flow for receipt of data with 4 of our clients, right? It's still buggy, but we're trying to fix it, and we'll eventually fix it by March. So that's what I'm trying to say. There are so many people working on this problem statement now, right? Somebody is trying to solve for enrollment, right? How do you enroll people onto a policy with engaging content, a nice flexible benefit platform? Somebody is trying to solve for it from the lens of endorsement. Somebody will solve for it from the lens of claim management, right? And some will do all of it. Now, that I feel is the most beautiful part about wanting to implement a wellness plan in your company today. that you can, and this answers the question of the gentleman who I was answering before, that you can, or lady, sorry, it was anonymous. You can actually, just go online, search for your requirement, and you'll find 5 or 6 people who are willing to serve those, or solve those problems for you today.
True. Thank you so much for that, Raghuveer. Just 4 minutes in hand, and I just want to make the most of it. Sudeep, I'm coming to you very quickly on that.
Yeah, I mean, I'm going to take the last bit, right? Not only do you find resources outside, but you find resources within. Going back to that point, if you ask your workforce itself on solutions, they'll design it for you. A lot of the work that we've done in the last 2 years, whether it be on well-being, on recognition and stuff, is through hackathons that we, organized internally, and people came up with ideas and designed the solutions. So our chatbot, for example, is designed by our own people. And, we've now trained the chatbot to do well-being nudges, and we contextualize it for the different teams. The workplace group is managed completely by the teams themselves. And it's a fairly vibrant group with a lot of Q&A going on and support going out to each other. So I feel that's the other element I would probably call out. It's about, if you want to really get people participative, then let's just get teams themselves to design and build the solutions, right?
That's a beautiful thought and very, very inspirational one, Sudeep. Thank you so much. I just loved one thing in this panel, and I would want to share with the audience that there was a lot of honesty that came in this conversation. All my speakers took that out and they said, we're not the winners, but we're the doers. So we are in process of getting that change, and we will bring that change. And I think that's really, really amazing. So thank you so much. Due to the paucity of time now, I will have to move towards wrapping up the discussion. But just I can let you know that please feel free to connect with Raghuveer, Sudeep, Amit. You can reach out to them on LinkedIn. You can find more answers for whatever questions were left unanswered today. So apologies for that, but thank you so much, everyone. And yes, a big thank you to Amit, Sudeep, and Raghuveer. I think you guys were terrific. You made the session really memorable, and lots of anecdotes that came forward. So big thank you once again.
Thank you. Pleasure being here.
It was a pleasure.
Thanks, everyone.
Thank you. And for our audience, I think it is said that, we create our tomorrow by what we dream today. And that really sums up the discussion that we had. I hope you enjoyed it, because I really did. Do let us know how we fared on that. You all have been a wonderful audience throughout. So thank you so much for joining us today. I would also like to express my gratitude to Policy Bazaar and Economic Times HR World's team, who worked tirelessly to put this on, this session for you. So thank you once again, and have a wonderful day ahead, everyone. Bye-bye.
Bye. Take care, everyone.